Vaccination rates are going down for young kids, and the numbers are even lower here in Minnesota. Gordon Severson explains why doctors are concerned.
Yeah, these are the standard routine vaccines that most children get for diseases like measles, mumps, polio, diseases we really haven't had to worry about for decades. But doctors are concerned that with these low vaccination rates, some of these diseases will start showing up again. At this Hennepin Healthcare Clinic in Golden Valley, there's no shortage of vaccines for young kids.
This one's age 4 to 5. It's called Kinrix, kind of the kindergarten vaccine.
But doctors say there is a shortage of kids showing up to receive them.
We are getting to the point, for example, with measles, where the vaccination rate needs to be 95% or higher, and we are dropped below 90% in the state of Minnesota.
According to a new CDC report, Minnesota has the 9th lowest vaccination rate for measles, mumps, and rubella among kindergartners, and lower than average rates for several other vaccines.
This is really something that we as pediatricians and public health professionals are really worried about.
Dr. Leslie King-Schultz says the rates are even lower for 2-year-olds. She says doctors normally want to see between 60 to 70% of 2-year-olds caught up with their vaccines. But currently,
we are looking at percentages that are below 50%.
She says the pandemic is the biggest reason behind this drop. Also, more parents who are worried about the safety of vaccines.
I think people have been lulled into feeling like they're not necessary because we don't see those diseases anymore because the vaccinations have been so successful.
At Hennepin Healthcare, they are now compiling lists of children who are behind on their vaccines and calling their parents to set up appointments. They're also sending out their mobile clinic to communities that have the lowest vaccination rates.
We worry because once you drop below those herd immunity thresholds, then those diseases can spread much more easily within the community. There's no longer that bubble of protection.
The CDC says this lower vaccination rate means about 250,000 kindergartners nationwide aren't fully protected against diseases like measles. The state health department reported 22 cases of measles in Minnesota last year after 3 straight years without a single case.
All right, interesting. Thank you, Gordon.